Hi friends, I'm Dr.S.Asha Devi, obstetrician and gynecologist. Today, let's see what safety measures are to be followed when a pregnant mother travels. Most of the pregnant mothers can safely travel in pregnancy, although there are a few conditions where we specifically advise to restrict or even avoid travel. I have listed out the conditions towards the end of the video. What are the precautions to follow during a bike travel? Pregnant mothers can safely travel in a bike provided they are able to follow few small things which I am going to list out. Irrespective of whether the pregnant mother is riding the bike or sitting at the back seat, it is important that all of them wear their helmet. Next, coming to the position, pregnant mothers can choose a position which is comfortable for them so that they don't tip the balance. So even if they would like to sit in the seat with the legs on either side, it is completely fine, provided they get a better balance during the journey. Whenever you're choosing to travel in a bike, it is important that you take a routine route and don't try anything new so that you are well acquainted to the jerks and bumps. As much as possible, take the travel during the non-peak hours, like if you're going to travel to your workplace, it's important that you prepare yourself for the travel at least some 15 or 20 minutes earlier so that you are able to avoid the peak hours and the unnecessary rush and the traffic. How to safely travel in a car? All pregnant mothers can safely travel in a car provided they secure themselves with a seat belt. So this is a picture showing how a pregnant mother should be wearing a seat belt. Irrespective of the timing of work, it is important that all pregnant mothers plan their travel at least 15 to 20 minutes early so that they are able to avoid the peak hours of traffic. In this way, unnecessary rush and also unnecessary jerks and bumps can be avoided. What are the safety measures to follow during train journey? Most of the pregnant mothers choose the train journey, especially when they wish to go to their mother's place. In pregnancy, it is completely safe to travel if you are less than 34 weeks of gestation. And now, what are the simple things to follow when you choose a train journey? As much as possible, choose the lower berth. Because you're going to take a long distance travel, you may have to use the restroom multiple times. This may put you at a small risk for urinary tract infection. And how can you reduce the risk? The first thing is that try and use the restroom immediately after you check in because it is well maintained when the journey starts. The second thing, we have this disposable toilet seats and the Spee Buddies available which are completely eco-friendly. If you are able to purchase them and carry them with you, this can, to a very great extent, reduce your chances of developing urinary tract infection. Train journeys are generally for a long distance travel. So as much as possible, drink a lot of water and keep yourself well hydrated. What are the precautions to take during a flight journey? Generally, in pregnancy, it is safe to travel until 28 weeks of gestation, although in some airlines, they do encourage travel until 32 weeks. So before planning your travel, it is important to check with your airlines and then book your tickets accordingly. The commonest thing the pregnant women ask us is, are these security scanners safe when they are going to check into the flight? Yes, security scanners are completely safe for you and your baby. And whenever you are taking a flight travel, you can safely fasten the seat belt as I have shown the picture for the car travel. The next is how you are going to maintain yourself during the flight journey. If you plan traveling in a flight for longer hours, that is more than 4 hours, there is a small chance that you can develop blood clots in your legs. And if these blood clots pass through your blood into the lungs, you can end up having serious problems. So how can you protect yourself from such a risk? It is important you stay well hydrated during your flight journey. Take intermittent walks and don't keep sitting in the seat for longer hours. And as much as possible, do small stretches of your legs so that this will help in improving the blood circulation in your legs. When all do you need to restrict or avoid travel in pregnancy? If you are at the 37th week, or otherwise we call it a term pregnancy, if you had bleeding in the last 2 weeks, if you have blood pressure or sugars which are uncontrolled during pregnancy, or if you've been having any health related problems like heart issues, blood clotting issues, or seizure disorders, If you have severe lung compromises like severe asthma or other lung diseases, and specifically a condition called placenta previa, where the afterbirth is sitting very close to the mouth of the uterus. So, in all these above mentioned conditions, it is very important that you seek medical advice before you take a decision of travel during pregnancy. So, my dear friends, let me conclude with one important point. Whenever you choose to travel during pregnancy, please ensure that your health records are backed up in the cloud so that you have access to them on an emergency need. Thank you. Hope this video was helpful for you.